Oh, boy.
Good evening, good evening, good evening. Welcome to this evening's webinar. My name is Michael Miner. I'm the National Director of the National Baptist Convention, USA Incorporated, Hope Health Ministry. We're doing this webinar tonight in collaboration with Get Covered Mississippi, an initiative of Oak Hill Regional Community Development Corporation. Look, we hope that you all will join us tonight for a lively discussion about the American Rescue Plan and the new Affordable Care Act subsidies. We are restreaming tonight on our different social media platforms, including Facebook and YouTube. So for those of you all that are not able to join us by virtue of Zoom, we'll do our best tonight to capture your questions, comments as we share on this evening. Let me recognize the president of our National Baptist Convention, USA Incorporated, Dr. Jerry Young, our General Secretary, Dr. Alvin Edwards, and the chair of our federal faith-based initiatives, Dr. Alvin Love. We also want to bring you greetings on behalf of Get Covered Mississippi, Oak Hill Regional Community Development Corporation, our board chair, Jennifer Garrett, our project director, Lottie Miner, and the executive director, yours truly, Michael Miner. We certainly hope tonight that you will leave this session with a renewed interest in promoting the Affordable Care Act, a better understanding of this effort, and hopefully sharing some information in outreach, education, and even enrollment for some of those in our families, our friends, and communities, and our churches. Tonight, we're fortunate to have a dynamic panel who will conduct a Q&A format. And then once we're done, we'll be able to field questions from you all. Feel free to type in your comments or your questions in the chat, and we will do our best to respond to them during the question and answer period. We're going to go directly through our panel discussion first, then we'll handle the questions and answers because we want to make sure we have enough time to carry the things through. Let me give you a brief overview of what we're doing tonight. And again, greetings. And you can find more about us at hopenbc.com, hopenbc.com. And I do acknowledge our production staff technician, Brother Thomas Duke Robinson. All right, according to the Kaiser Family Foundation, the American Rescue Plan, also known as ARP, the recently signed into law by President Biden, increases and expands eligibility for Affordable Care Act premium subsidies, the ACA, for people enrolled in marketplace health plans. The law also creates new temporary premium subsidies for COBRA continuation coverage. And it temporarily changes the rules for year-end tax reconciliation of marketplace premium subsidies. These changes will improve the affordability of coverage for individuals who are already enrolled in marketplace health plans and will provide millions more an opportunity to newly sign up for coverage with increased financial assistance this year. The law also makes changes to the Medicaid program designed to increase coverage, expand benefits, and adjust federal financing. All right, that's our overview of what we're going to try to cover tonight. All right, this is the flow tonight. I will provide a brief overview of the ACA. And we do send regrets tonight on behalf of Derek Gilliard of the HHS regional office. He had an emergency come up. He was going to share some updates from on the national scene, but he sent me some information and I will share that. So then once I'm done, we'll go to Clarence Campbell. Let me just highlight Brother Clarence here. Brother Clarence, and he will share information about the Affordable Care Act. And let me just say a few things about him. He is one of our, he's had an extensive career working at General Motors Corporation, and he's now a certified navigator for Oak Hill Regional CDC. He leads Oak Hill's virtual enrollment efforts. He's also a certified IRS VITA volunteer, assisting consumers with free tax help for the last few years. And he will be after I finish, you'll hear from Brother Clarence Campbell. Thank you, Brother Clarence, for joining us today. All right. Then after that, we'll have Mary Fenner, who will share about Medicaid and the Children's Health Insurance Program. Mary's had extensive career of helping others. She worked for the Mississippi Division of Medicaid for a number of years. After retirement, she expanded her time working in the church's outreach ministry. A couple of years ago, she began working for Oak Hill's Healthy Kids Initiative as an assistant and application administrator. And she has indeed been a blessing for many across the state of Mississippi. Thank you for joining us tonight, Sister Fenner. All right. Okay. All right. Let's get this thing rolling. Again, feel free to share in our chat, and those that are watching on social media will do our best to capture what question that you have. All right. Now, the Affordable Care Act, also known as Obamacare, it's just 10 years old last year. Now it's 11 years old, and the proper name for it is the Patient Protection and Affordable Care Act, the PPACA. It's shortened to Affordable Care Act, and many of us know it as Obamacare because it was passed under former President Barack Obama. It's a landmark health reform legislation signed into law in March 2010. The key provisions extend coverage to millions of uninsured Americans. Not only did it do that, it implemented measures to lower healthcare costs and improve system efficiency. It eliminated insurance industry practices, and this is the biggie, that included rescission and denial of coverage due to pre-existing conditions. It also allowed parents to keep their children on their health insurance until they reach the age of 26. Now, let's be clear, you all. The ACA is not government insurance, health insurance, like Medicare. No, it's not. Instead, it's consumers purchasing private insurance. Catch that. Consumers purchasing private insurance through a federal or state-based exchange or marketplace. Now, the one thing about the ACA plans, they must cover 10 essential benefits. And we want to just highlight that. The 10 essential benefits. This is what a marketplace plan covers. All right. So the reason why this is important, before the ACA, we had what we call skinny plans or hospitalization plans. I remember some of those plans that people have them and they would get sick and they would go to the hospital and they find out they had a $10,000 deductible, or it didn't cover prescription drugs, didn't cover the doctor visit. And you were like saying, wow, what do I really have? Well, one of the things that the Affordable Care Act sought to do was to make sure that they had these certified plans through the Affordable Care Act, and they would cover these 10 essential health benefits. Now, they may be able to cover more, but it has to cover these 10. A couple of things that I want to highlight is maternity and newborn care. Okay, maternity and newborn care. All right. Before, and I know we have quite a few women that's involved in the health ministry, it was said that women had a pre-existing condition that they could get pregnant and you had to pay more. But now that is included under the 10 benefits. And the second part is mental health. Mental health, that's important. You know, when we work with the H.O.P.E Health Ministry, we talk about Trinity wellness, mind, body, and spirit. And we're quick to work on from a faith side on the religion and on the secular side on the physical health. We'll forget about mental health, and that is one of the essential benefits under the ACA. You can go to healthcare.gov. We'll type that in the chat, and we'll also share that on our social media platforms. Healthcare.gov to learn more about that information. All right. So the key thing that we want to take away from this, let's make sure we got it, make sure we bring it in, make sure it's rock and rolling with us, is that the Affordable Care Act is not, N-O-T, is not a federal health insurance program. It is private insurance. Now, if you don't believe it, guess what? My wife and I are covered through a plan in the marketplace. I was waiting for that for the closer. Yes, we have been covered. I had a pre-existing condition. In January 1st, 2014, I walked into Walgreens and showed them my health insurance card. And we'll let you know, with our income, we didn't qualify for a subsidy. So we do pay a decent premium, okay? But it is health insurance, and I'm not plugging in an insurance company, but for full disclosure, we have coverage through Cigna. And I go in and I have my claims and everything else. So it's just as if I were working for a private company had it, except now that we can do it in individual way. So again, newsflash, yes, I am covered. My wife is covered through the Affordable Care Act, through Obamacare, and we get great coverage with great hospitals, great visits. Look, I still got 5 fingers on both my hands and everything. They have done a great job in doing it. We've been on it since the first day that coverage was available. All right. Again, private insurance through a government, which would be federal or state-based marketplace. It is not N-O-T. Don't care what folks say. It is not welfare. Look, when we pay our bill every month, I'll let you know it is not welfare. All right. Look, we are in. He had texted me and told me that, emailed me that he had something to come up. If he gives me a thumbs up, I guess he still wants to try it. Yes, he does. Okay. All right. He's on the road here. Okay. All right. Well, let me do this now. Let me take this off the screen. Okay. All right. So let me introduce our panelists, and I am honored. Derek Gilliard, he's a public affairs specialist at the U.S. Department of Health and Human Services, based in the HHS's Atlanta regional office. He's a 30-year communications professional. He started when he was 12, who has run his own company, worked successfully in higher education, college and community relations, governmental public affairs, and social justice advocacy and public affairs. He's also a historian, a trained facilitator in racial reconciliation, and a motivational speaker. now working for his fourth president. Hey, what's that now? He serves as the communication lead for the U.S. Department of Health and Human Services, regional director for the 8 southeastern states. That includes Mississippi, where we work. His portfolio is focused on reducing drug pricing, addressing the opioid and vaping crisis, rural and maternal health, and other key issues. During the previous administration, he focused on education and implementation around the Affordable Care Act, while working with providers, elected officials, CBOs, small businesses, enrollment assistants, and the general public within the 8 southeastern states. Ladies and gentlemen, I present to you our esteemed panelists, Derek Gilliard. Good evening. Good evening. Unmute yourself. Good evening.
Thank you, Dr. Miner. I apologize for being on the road, but I wanted to join you if all possible. My wife's been gracious enough to drive, so
thank you.
Glad to be here. And the second most favorite state I have is Mississippi, and I look forward to coming back because we were quarantined for 4 years during the last administration, as you well know.
Right. All right. Well, look. All right. Again, a big shout out to the missus. All right. All right. Here we go. All right. Okay. All right. So to do this, Brother Clarence, we're going to put you in second. We're going to let Brother Derek get him taken care of first. Okay. All right. Here we go. Let's ask some questions here. All right. Get my script. All right. Now, thanks so much for doing the extra effort of being on tonight. All right. So let's begin by, let's talk a little bit more. That was the previous administration. What is your book of work now in the regional office?
Yeah, thank you. You're right, because you were working from an old bio, and I admit that. So yes, now it is certainly first and foremost dealing with COVID and the effects of COVID, getting people prepared, getting people vaccinated and educated so that they will be, so they will know the truth from, our perspective. As you know, Dr. Miner, during the last administration, there was a reluctance to be fully honest and open about what was going on. And so I thought that one of my favorite people was old Churchill, because remember during World War II, you don't remember, I don't remember, but he told his people, hey, they were going to be in for a hard time, but they were going to survive it. But he was honest. He prepared them. And I think that people much more appreciate knowing what they're dealing with than somebody snowing them.
Right. And
so those are the key issues. And you mentioned mental health. And so the federal government has, since the Biden administration has come on board, is earmarked $3 billion for mental health, including substance abuse and PTSD, just everything that's, and there's such stress because of the pandemic. People, we found that domestic violence has gone up, human trafficking has gone up, substance abuse disorders, all these maladies are magnified because people don't have access to services, number one. And number two, in some instances, are kind of, they're locked in with people who abuse them. And so we understand that there is a hugely critical issue. And when I'm not talking, I will mute so that I'm less noisy.
No problem. All right. But how long have you worked for the regional office?
So this is my 22nd year. I think I came in on the tail end of the Clinton administration. And as you said, so I've done, 8 with Bush, 8 with Obama, 4 with Trump, and now here we are with Biden.
So that means that you've been involved with the ACA effort since it got started then.
Absolutely. You know what? One of the highlights of my year, I'm going to be honest with you, was that top to the bottom tour that we would do to kick off the ACA every year. I loved it. I got a taste, a real taste too, some of that catfish and some other things that you all have down there. But I got a real feel for Mississippi, and I love the spirit of Mississippians. And despite whatever odds, whatever they're challenged with, they say, hey, we can come together and do more with less because we've always had to do that, and we're going to continue to do it, and we're going to survive, and we're going to overcome. And I love that.
All right, thank you. And guess what, everybody? I didn't pay him to say that either. All right. Well, look.
You did not.
All right. Well, I know that you're rolling, man. Have you noticed fun? But can you give us some idea about the effect we've seen on the American Rescue Plan, on the ACA changes? I think we've heard about the enrollment numbers that we've had since these changes have been instituted.
Absolutely. As of the end of last month, there were 500,000 people who had enrolled. And I can tell you that.
Wait a minute now. Hold up. 500,000. This is not including last year's open enrollment.
That's right. Just in the SEP, just as part of the SEP.
From February 15th.
That's right. That's right. And you know what that tells you is that people were really, really wanting to be enrolled, but obviously they couldn't get out and see people, and the access wasn't there. And again, the information wasn't free flowing. So there were all kind of things. You know, when they've tried to keep the ACA away from people, people have wanted it more. And I think it's a really good thing. And what we have now is a president who is trying to put meat back on the bones that were stripped away by the last administration. You know, it's almost like, hey, you don't have to put a pillow over a child's head to suffocate them. You just can take away love and nutrition. And that's largely what was done with the ACA through the last administration. So I'm so excited to be working for someone who understands the sanctity of health and wellness for people, especially people like Black and brown people who have been prevented from having it for so many years. And I do know that so many people, there's almost a 50% increase in people who are at or just below the poverty level who are enrolling in the ACA now with all the new subsidies and all of the enhancements. I think it's helped tremendously.
All right. Well, we represent a lot of churches, and even more than just National Baptist churches. Are there any type of resources or things that are available that the congregations that we support, that they can tap into to share in the congregations?
Absolutely. One thing that we encourage everyone to do is to consider signing up for the community core. And what that is, this will get you direct information that will come straight from the White House and the HHS secretary. Once a week, you will get updates on everything from ACA to what's going on with COVID, new opportunities in your area. And specifically for churches, we have a Center for Neighborhood and Faith-Based Partnerships. And I don't have the website right now, and maybe you can pull it up, Dr. Miner, but they also have a weekly newsletter. And one of the things that comes out, they'll have webinars and presentations by pastors. And sometimes they'll deal with different things like dealing with a congregation in the midst of COVID, how you safely reopen your church if your church has closed, you know, all the safety precautions that you have to put in place, ways that you can work with the state and other institutions to get your people vaccinated. So there are a litany of things that and even mental health for pastors, because you know there's stress on pastors too. Leadership isn't exempt from this. So there are many different and as you know, Dr. Miner, my wife's a pastor, and I've had her check into several of those for the churches that she has leadership of. So I think that I found that it is critical. Last week, as a matter of fact, I talked to a group of pastors from across the country, and these were evangelicals, and talked to them about these very things. And so I think that as you know yourself, what the word tells us, my people perish for lack of knowledge. So one of the things that we're working to do is make sure that void is filled as best we can. And with partners like you who've been on the forefront the entire time, whether we're talking about, you know, kids coverage or the ACA or just even COVID, you know, it's been fantastic to have partners like you out in the region.
All right, appreciate it. Well, look, I'm gonna say the toughest question for last. This Medicaid expansion. Now we know in this last bill, the Biden administration put even greater incentives for states to expand Medicaid, but we know many states that did not expand, including Mississippi, did not. Could you just kind of, I guess the high level, explain to us what the Medicaid expansion would do? We'll have our discussion later on the reason why people won't do it, but why would it be really advantageous for states to expand Medicaid?
You're absolutely right. I mean, we can't understand why any state would not expand Medicaid when the federal government promising to pay 90% for the first 5 years, and the states only incurring 10% per year after that on an increasing basis. And it's almost like, and you may remember this from back, I don't know, maybe it's 10 years or so ago, Fram oil filter had this commercial. They said, pay me now or pay me later. So if you don't insure our people, if we can't insure them, what they do is use the emergency room as a primary care. And we know that that's always going to cost 3, 4, 5 times as much. So, there's no rationale that we can see. And so what we're finding is we're going back out and reintroducing these options. More and more states are really looking at it. And I think some of them have already committed and saying, yes, we're going to do it. We cannot continue to keep going down this rabbit hole. I remember when the ACA was first rolled out and these incentives towards expansion was there, in the state of Kentucky was the only of the 8 southeastern states that said, look, we know we need help. You're offering help. We're going to take it. So we're really hopeful, and I'll say to you, prayerful, that more and more states will, because we'll have a healthier country and we'll have a healthier people if we go ahead and do this.
All right. Well, look, is there anything else quick you wanted to say?
I thank you for the opportunity. I sure wish I could catch the rest of the meeting, but I'm so glad that you made this forum available for me, and I look forward to my next trip to Mississippi.
No problem. And then kudos, prayers, blessings, wonderful for your wonderful wife for driving so they participate. Y'all
thank you,
safe,
sir.
Okay?
Take care.
Okay.
Bye-bye.
All right. Bye-bye. All right, again, we thank Derek Gilliard for, wow, you all, that just shows his commitment to this work that he had an emergency he had to go to. So he hopped in the car and he wanted to be on tonight and share with us. And there's a counterpart for him in each part of the country. So those that are watching from other parts of the United States on tonight, there's a Derek Gilliard in your region. Look, if you have not got in contact with your regional office from HHS, go to our website, hopenbc.com, and we got information about there on how you connect. If you still need further information, email us at info@hopenbc.com, and we'll be more than happy to share that information with you. A couple of things that Derek would have covered. This is also Minority Health Month. And Minority Health Month, the emphasis this time around is on the vaccine, and the hashtag is vaccine ready. All right. Okay. All right. Look, this is our first poll question for tonight. Let's start with this one before, then we're going to bring Brother Clarence in. All right. Our first question for tonight. Are you or someone you know enrolled in health insurance coverage through the Affordable Care Act? Now, we know we got way more folks, a ton of people watching on social media. Unfortunately, we're not to take it across on, we're not able to take our social media. But those y'all that own, if you would take an opportunity to respond, we appreciate. I don't know if I set it up for the panelists or not, but we'll see what we have here on getting this done. Just want to get a feel for who we have on with us on tonight. And then Brother Clarence will come and we're going to talk about how these changes really work for us. All right. Okay, give you a second. Some people call it the Affordable Care Act. Some people call it Obamacare. We have seen all the things on TV about folks that get rid of that Obamacare, but I need my Affordable Care Act. Hey, go figure. Just how things are. All right, I'm looking here and we just about got everybody captured. All right, let me close it out. It looks like that we have 63% of you all are, or you know of someone who is, yes, good, for the Affordable Care Act. Okay. All right, here we go. We're going to bring in Brother Clarence Campbell now. okay? And he is going to walk us through quite a few things. Good evening, Brother Clarence.
Good evening, everyone. Nice to be here.
Good. Let's jump right into this thing now. We want to be timely tonight. All right. What did the American Rescue Plan Act of 2021 do for the marketplace subsidies?
Okay, the American Rescue Plan Act of 2021, also known as COVID-19 Relief Law, which was just passed in March, expands marketplace subsidies above 400% of the FPL or the federal poverty level, and also increases subsidies for those making between 100 and 400% of the poverty level. This will be for 2 years, 2021 and 2022. And this is consistent with what President Biden proposed during his campaign.
Excellent. Promises made, promises kept. Okay. Well, let me ask, how will these changes in subsidies affect the premium paid by those who enroll or who've already enrolled in marketplace coverage?
All right. These additional subsidies yield substantially lower premium payments for the vast majority of the nearly 15 million uninsured people who are eligible to buy on the marketplace and the nearly 14 million people insured on the individual market. With some exceptions, in the case of the highest income enrollees whose premiums may not be high enough to qualify for subsidy, most of these 29 million people could see lower health insurance premiums as a result of these subsidies. And many could also afford new lower deductible plans.
All right, so everybody, you heard about that. So some people who may have been running away from the Affordable Care Act back to November 1st, December 15th, they need to come back. They might find it a lot more advantageous. Well, now this sounds a great benefit to those already enrolled in the ACA and a great opportunity for those who are not enrolled. How many people do you think will take advantage of this opportunity?
It's far from certain how many people are going to take advantage of new financial assistance.
All right, well,
we heard from Derek how many new enrollees that we do have since the SEP opened up back in February 15th.
And I would say there's probably some people on the call and on social media tonight that know some people need coverage. Let them add to the number. Be part of the number. All right. Now, how does the changes in the ACA under the American Rescue Plan help those on the subsidy cliff? And of course, would you begin by defining what the subsidy cliff is? Okay.
Okay. The term subsidy cliff refers to the steep drop off of health insurance subsidies for those with an annual income of just above 400% of the federal poverty level. We estimate that there are about 8 million people who either are buying unsubsidized plans or paying full price for Affordable Care Act coverage before the COVID-19 relief legislation went into effect. This included an estimated 3.4 million uninsured people who fell into the subsidy cliff. That is, they may have had incomes too high to qualify them for subsidies under the ACA. Additionally, it included about 3.3 million people buying off exchange coverage and about 1.4 million people buying unsubsidized on exchange plans, presumably because many were ineligible to buy subsidy coverage.
Right. So the thing is that what it sounds like to me is that, again, there are people who got coverage, who have home coverage, and with the changes that they may have an opportunity now to get some lower premiums. That's what I'm hearing. So that's a good thing. But I also read that it has some the American Rescue Plan when it comes to the ACA has some things dealing with COBRA. Are there any special benefits on the American Rescue Plan for consumers who are maybe contemplating or under COBRA coverage?
Okay, yes, there are COBRA coverage subsidies. COBRA continuation coverage allows people who lose coverage under an employee health plan to purchase it through their employer-sponsored plans for firms with more than 20 workers. Usually this lasts up to 18 months. Typically, though, COBRA coverage is very expensive because the employee must pay a premium of up to 102% of the total cost. This includes the amount that the employee formerly paid, as well as the amount formerly paid by the employer. But it does allow individuals who lose the employer coverage to continue to see their doctors, and it frees them from having to satisfy a new deductible if they were to get an additional plan, a newer plan.
All right. So again, okay, everybody listening, everybody's going to listen later on. and there's some people getting laid off even right now because companies are still right sizing. They don't publicize, they're right sizing. So one of the things they offer, hey, we'll give you your coverage. And a few will actually pay for it, but some of them said, look, we'll give you the option. You can continue your coverage on COBRA. And look, you just lost your job. You got right size. You're not trying to spend that kind of money. But look at here, under this program for the American Rescue
There's
Plan.
also some additional information about that need to throw in too. The American Rescue Plan provides a federal subsidy of 100% of your COBRA premiums for people who lose.
Could you say it again? How much percent of your COBRA premiums?
100%.
Wow. Okay.
These subsidies will be available from April to September of this year, 2021.
Okay.
And paid through tax credits to the employers with self-insured plans and to the insurers for the insured plans. And another good thing about this is not considered taxable income for those individuals who take advantage of this.
Wow. Okay. Once again, everybody that's listening, somebody gets right size or otherwise on here for this COBRA coverage on the American Rescue Plan, the ACA, they can get 100% of their premiums paid. Wonderful. Well, then how would people qualify for these subsidies?
Well, employers and insurers must provide notice of coverage subsidies to potential beneficiaries when they become eligible, as well as when the subsidies end. If people did not enroll in COBRA when they lost their job earlier in the pandemic, or enrolled but later dropped coverage, they may now enroll in subsidized coverage within 60 days of it becoming available or when they receive notice from their employer. Under separate guidance from the Department of Labor, people can enroll up to 60 days from the end of the year after initial eligibility or the end of the current public emergency, whichever is sooner. This means that individuals who did not enroll in COBRA because of the cost late last year or early this year may now enroll in the heavily subsidized COBRA benefits.
So it looks like anybody that's on COBRA now or going all the way back to the end of last year needs to check it out. There may be some benefit available to you.
Correct.
Okay, good. All right. Now, we know that consumers can go to healthcare.gov. That's the site. They can find out more information. They can enroll. But however, where would a person to go get assistance? You know, you look at that stuff and you get kind of cross-eyed trying to figure out where would they go to get assistance in enrolling in a plan?
Okay, well, there's great resources on healthcare.gov. It's well put together website, but it's also confusing for a lot of people, and a lot of people aren't quite as computer literate as us geniuses here, right?
Hey.
Okay, but fortunately, you can find assistance through federally certified navigators, and I happen to be one of those, and then also certified application counselors.
All right, and I'm a navigator too. I tell you, I've been a navigator since the program started, so I'm happy, glad to be a part of it. Well, okay, we talk about these navigators and these certified application assisters. Okay, so who are they? What do they do? These navigators, these certified application counselors.
Okay, well, we're individuals who are certified by the United States Department of Health and Human Services to provide outreach, education, enrollment assistance to consumers. We don't charge a fee, and we offer unbiased information. And in order to obtain our certification, there's a pretty substantial amount of training that we have to go through to make sure that we understand the different provisions of the program. And then it's continually impressed upon us that we are to remain unbiased.
Exactly. And what's the charge again for these services?
Absolutely nothing.
Wow. Free. All right. Well, one other thing I forgot to talk about earlier on this, what about the changes in the ACA and the American Rescue Plan when it comes to people receiving unemployment insurance payments?
Okay, well, the COVID-19 relief law makes special considerations for people approved to receive or receiving unemployment compensation at any point in 2021. Under the COVID-19 relief law, if a person is receiving unemployment compensation and they qualify to purchase insurance on the marketplace, they and any of their eligible dependents can get a silver plan with the $0 premium. Okay, and silver plan. What does that mean? Silver plan are within the marketplace. There's three what they call metal level plans: bronze, silver, and gold.
Mm-hmm.
The bronze plans have notoriously low premiums a lot of time, but extremely high deductibles.
Right.
So by moving into the silver plan, then you're able to get a plan that's going to not have a great deal amount of out of pocket for you. And then also, if you get the premium tax credits, your premiums probably won't be that much each month.
Okay.
So we can quite often get a silver plan with a $0 premium, and that's because under the proposal, any household income above 133% of the federal poverty level is not considered in the calculation of your premium tax credits if you're receiving unemployment compensation.
All right. I think the thing that we've come to the conclusion is you got nothing to lose by going to healthcare.gov and seeing what's what, and you got everything to gain on that. All right. And is this unemployment insurance assistance for those, is that available now, or is that going to be available later?
Not available just yet. It's going to be available a little bit later on this summer.
Okay. All right. And then since you brought that up, I am going to type into the chat for all our panelists and attendees. This is the link to the Find Local Help. Now, we want to just let you know that there are two sets of help in there. There's got insurance brokers, and it's got navigators, and you got certified application counselors. So you want to look for the navigators and the certified application counselors where you are. If not, you can still inbox us at info@hopenbc.com and be more than happy to share with you. Well, look, Brother Clarence, you've covered a lot of ground tonight. Is there anything else that we missed that we think we should share about it before we move on to Sister Fenner?
Healthcare.gov outside the state of Mississippi and state of Mississippi, get covered in MS if you need help.
Get over MS or the number 662-298-3584 if you are in the state of Mississippi. Amen. Look at that. All right. Wonderful. Thank you, Brother Clarence, so much for and those y'all have questions, he'll be coming back. So now we're gonna move on to our third panelist tonight, Mary Fenner. All right. Okay. We're gonna bring her up right now. Gonna bring her in and add her to the screen. All right, there we go. Okay, welcome again. All right.
Hello, everyone.
Okay, and she is ready to rock and roll tonight. She is we call her the Medicaid lady. Okay. All right. Now we're gonna hear from she again, a sister from Healthy Kids, Mississippi. All right, let's begin with the basics. We know that Medicaid is a federal state-run insurance program that varies by state. However, in general, when it comes to children's health insurance coverage, what is Medicaid?
Okay, Medicaid is a health insurance program, and it provides assistance for children, their caregivers, and low-income families.
Okay. Well, now there's also another program that helps out kids, children.
Yes, it's called
what's that? What is that program?
Children's Health Insurance Program. It's called CHIP, and
Okay.
what it does, it covers children that their families make too much. The income is so high that they're not covered by Medicaid, so they may be covered by the CHIP program, and it runs the same.
Okay, so everybody, you hear that now. Let's make sure we got it. So there are some people now. Notice what she said. Their income is too much for Medicaid. They may qualify for the children's health insurance program. Now, we're not talking about folks making $100,000.
No.
We're talking about some folks whose income just maybe just
a little
bit. Hey, Sister Fenner, you know what I call that program? I call it the bridge program. It allows you a bridge from you trying to make more income. I believe in things like that to get you up and rolling to your next level. Wonderful. Okay, here we go. All right, now it sounds like Medicaid for children and their caregivers and CHIP are insurance programs. Insurance. okay, and not welfare. Isn't that right, Sister Fenner?
That's true. It's a health insurance program, and as stated before, which provides health coverage only. And there's no money involved given to the actual recipients. It's only health care coverage. So it's a health insurance program.
But you know, it's so sad that people call it welfare. Wow.
Yeah.
But everybody, we want to come back again, everybody. Everybody, listen to what we just said. We said it is an insurance program. Insurance program. Okay. Now, who may qualify for Medicaid for children and CHIP?
Okay. Children's Medicaid eligibility varies widely by state.
Okay.
However, for CHIP, the upper eligibility levels from as low as 170% of the federal poverty level, FPL, up to 400% of the FPL, and vary by state. CHIP and Medicaid eligibility levels can be viewed on the Medicaid and CHIP eligibility levels page.
All right, well, let me do that. Okay, we're gonna do this in for you. We typed it into the chat. Those that are on our watching on social media, just email us at info@hopenbc.com, and we'll be more than happy to share the information with you. And what we just posted there gives you, everybody, it gives you information about what the ranges are in your state, where you are. We know that varies from state to state. Okay. All right, now we're still going on. I know that that you're Mississippi based. But what are some of the general coverage benefits of the Medicaid for children and CHIP?
Okay, some of the general coverage benefits are office visits, inpatient hospital care, outpatient hospital care, prescription drugs, vaccines, vision, and eyeglasses.
Okay. What about our teeth?
Okay, it also provides general dentistry, oral surgery, and braces if they need some type of correction. Now, braces is only covered by Medicaid and not by the CHIP program, but braces are covered.
Okay. All right. Well, I tell you what we're going to do here then. Savannah, I'm also going to paste in here to the chat, a link that no matter what state, I see some people here from all across the country that are watching. This last link will give you a link to go to for whatever your state is on how to apply. So remember what she said, that Medicaid will cover the braces, but the CHIP will not. So even though there are similar programs, they're not the same program.
True.
Okay. All right. Now, I know there's a special provision for pregnant mothers. Would you share something about those provisions?
Okay, it covers their visits to the doctor. Also, it'll cover their hospital once they have the baby. And once the baby is born, the baby will automatically be put on Medicaid. So the baby is covered for at least a whole year. Also, the mother gets 2 months postpartum.
In Mississippi.
In Mississippi.
But in other states, go ahead.
It was some talk of extending it, and in one while they did, but it's gone back to the original where it's only 2 months.
But it was a federal option, and for those of y'all that are watching that are outside the state of Mississippi, some states did extend it to 1 year. You need to check with your state and see what their particular guidelines are. Okay. All right. So now, is there anything else that I need to? Yes. How would somebody apply for Medicaid? Yeah. How would they apply for Medicaid?
You can go to the Medicaid webpage. That's one option.
All right. For wherever your state is, and find where your is, and we also put that in the chat. Go ahead, Sister Vanna.
Also, for the state of Mississippi, we have assisters that can help you apply. Because right now the offices are closed to the public, but they're still processing applications. So if you need assistance in filing for Medicaid, you can contact our office and we can help you with that.
All right, that's for you in Mississippi. But guess what? The navigators, and I think in every except for 2 states. So the navigators Our sisters can help you with the Medicaid. There's somebody help you for free. So you want to contact them. If you get confused or get thrown off, again, email us at info@hopenbc.com and we'll be more than happy to adjust you. Now, Sister Finn, I ran through this stuff. I'm just thinking sometime, I'm not as old as I'm going to get, not young as I used to be. Is there anything else that I should have asked you that you'd like to cover before we go into wrap this up?
Okay. Medicaid also provides inpatient psychiatric care and outpatient hospital mental health services that's needed. Also, a lot of people feel like they're not eligible for Medicaid, so they won't apply. But the best thing is to apply. You don't lose anything. It's free. Just put in the application.
Everybody, I've heard this theme with the ACA, with the Medicaid for Children, with CHIP. Apply, try. You got nothing to lose. It doesn't cost you anything. All right. Thank you, Sister Fenner. Thank you. All right. Now we're getting ready for the best part. We're getting ready for the best part now. Getting ready for the best part. Getting ready for our Q&A. We want to hear from you. All right. You may type your question into using your virtual hand. Type your question in chat. Use your virtual hand, or you can we can unmute you. If you're on social media, we'll do our best to monitor it and ask any questions that you have. You can email us at info@hopenbc.com. If you're in Mississippi, you can email us at info@getcoveredms.org. So in Mississippi, info@getcoveredms.org. We do want to remind everyone that about the NIH's All of Us research program. Let me just slide to the side here. The NBC USA is an active participant. This program has been conducting monthly surveys of how people are doing coping during the pandemic. It is an opportunity where we will enroll 1 million or more people in health research. And there's a special emphasis on this that we are making for people with sickle cell. So why don't you go in and learn more information by going to joinallofus.org/together so that you can become 1 in a million. All right, let's bring our panelists up. We add our panelists to the screen here, and we're gonna have any questions. So we're gonna be filling any questions. So those that are, just raise your hand up if you have any questions. We'll also be scouring the chat. So we're gonna bring all our other two panelists back up, and we can see what questions that people have. Any questions? Cover a lot of ground tonight. Any questions? All right. Any questions? I'm checking our social media feed here. Any questions? All right. We do have a question here. Okay. So the question, I guess, is for you, Sister Fenner. So is this just for the birth parents of these children, or could it be for a grandparent that's raising children when it comes to these benefits?
Yes, it still depends on the grandparents are eligible if they're guardians of the children. If there's no parent in the household and they are the main guardian of the child, they can apply as well.
Okay, so we know some situation where something happens to a mother or something like that, and it ends up with it. So that's a possibility. They kind of look at that. Okay, all right. We want to make sure on that. Okay, all right. Here's another question on the for those parents. So what about people that the parents, they go for Medicaid and they go for, okay, we got that, and they go for CHIP and they don't qualify. Is there any other option for a parent for health insurance if they don't qualify for Medicaid or they don't qualify for CHIP? Another parent would qualify for CHIP, but the parent would qualify for Medicaid. Was there any other option for the parents?
There is no other option, not unless they are of a certain age. In the state of Mississippi, the ages between 19 and 64, there's not a program for them if they don't have any children in the household under the age of 19.
All right. So the thing is, so the cutoff then for Medicaid and CHIP would be up to age 19.
Right.
All right, there we go. The cutoff at age 19. All right. So let's piggyback on that. We have this. So there are some weird situations here, y'all. Check this out. And Sister Fenner and Brother Clarence, I talked about this, I think on a previous one of our calls we had. There are a few instances we've seen in Mississippi where the children will qualify for Medicaid or CHIP, and the parents will just eke in to the Affordable Care Act. There are a few cases that we've seen, the income was such that, and the number of children was such that the kids were covered under Medicaid or CHIP, and the parent was able to get on the Affordable Care Act. Not a whole lot, but there are a few that come on with that. Okay. All right, let me bring Brother Clarence on. So we have a question. What happens if a person cannot qualify the family for Medicaid, Children's Health Insurance Program, Affordable Care Act? What do they just do? They just be sick and die? Or is that's it for them? Is there any other option?
Okay, if an individual or family cannot qualify for any of the aforementioned programs, Medicaid, CHIP, Medicare, Affordable Care Act insurance, there are what are known as federally qualified health centers that are located in various locales throughout each state. Here in the state of Mississippi, there are 291 federally qualified health centers, and you can go to these centers and obtain coverage on your payment is based on your ability to pay. So obviously you'll have to present documentation of what your earnings are, what your expenses are, what type of insurance coverage you may or may not have, and your price schedule will be determined that way.
All right, and guess what we're gonna do, since you brought that up, we type this into the chat. This is the web page where you can type in your zip code and find the nearest federally qualified community health center. All right, I have a question for you, Sister Fenner. How soon will Medicaid and CHIP benefits begin once approved? Unmute yourself, Sister Fenner.
It takes about 30 days for the application to go through. They will contact you
in the state of
within 2
Mississippi.
weeks.
In the state of Mississippi.
In the state of Mississippi.
Right.
They will contact you within 2 weeks if they need additional information, but the application has to be processed within 30 days with an approval or denial.
And we're hearing from other states, from calls we've had, there are a few states where if you meet all the guidelines through healthcare.gov, you'll automatically be enrolled in Medicaid. You need to check your state. There are some states, if you put everything into the healthcare.gov site, they will automatically qualify you for Medicaid right then and there. Every state is different. The tendency is most of the places have a type of waiting period. Check it out, find out what's what. Okay. All right. We got any other questions here? We're looking at all our different little things here. Okay. Here is another question. All right. So I guess it's probably for you, Brother Clarence. They're saying that during the Trump administration, they were talking about these out of the marketplace plans that were much cheaper. They call them skinny plans and save a bunch of money and everything. So why isn't this current administration pushing these plans? They're a lot cheaper. So.
Right. Well, the reason that these plans are not being pushed is the premiums may be cheaper, but the coverage is skinny. The coverage is very unsubstantial, and then you might find yourself paying a tremendous amount of out-of-pocket. You might have $8,500 deductible that you have to pay out of pocket before the coverage will pick up.
Wow.
And then also, and one of the beauties of the Affordable Care Act is a lot of these skinny plans or other plans outside the marketplace, they may not offer the 10 essential benefits. They may not offer all 10 of those. And then probably the biggest one that they may not offer too is coverage for people with pre-existing conditions.
All right. So we know for pre-existing conditions, that is really problematic because once you get to a certain age, everybody has what? A pre-existing condition.
Pre-existing condition, correct.
Okay. All right. I'm seeing if you got any other questions here. Okay. All right. When we come up to our 8 o'clock hour, man, we covered a lot of information tonight. I want to thank our panelists again, Derek Gilliard. We're certainly praying for him as he goes where he's got to go on his travels. Sister Mary Fenner, thank you so much for joining us on tonight from Healthy Kids, Mississippi. Brother Clarence Campbell Jr. from Get Covered, Mississippi. Thank you so much for joining us on tonight. We couldn't have done it without you all. Thank you, thank you, thank you. All right, here we go. We're going to just do a little wrap up upcoming on Wednesday. I'm wrong week. All right, Tuesday, April 27th. We have a webinar on Introduction to Grant Writing, Part 1. Email us at info@hopenbc.com. We'll get you more information. Also, we're going to be premiering a video. We're working feverishly now to get it done up. It'll probably be up in the, go ahead and subscribe to our YouTube page. We have a great autism video that we did live on last night. We're working now to get it edited, and we're going to add it to our YouTube page. So that's on autism. We want to be able to get that so that you can have that information as well. We're going to copy and paste into the chat now our, there we go. That is the link to our Hope YouTube page. All right, we also continue our series on Turn Obesity Around, our newest initiative from the National Baptist Convention USA Incorporated. If you missed our first webinar in March, you don't want to miss the second one. We'll be highlighting the Southeast region. It'll be Thursday, May 20th. That's Thursday, May 20th at 8 p.m. Eastern Time, 7 o'clock Central. You know what? You want to be there. You want to be a part of that. The first one was just out of this world. We're still getting positive feedback. We're going all through the different ways that we can work to battle this obesity thing. Everything from changing of attitudes, and if necessary, medication or surgery. We're going through all the different options, working through each one of these aspects, and want to make sure that you become a part of this. And we do appreciate and thank our sponsor, Novo Nordisk. I just put in the chat there the link for that you can register for that webinar. All right. This is Minority Health Month. And Minority Health Month is this, as we said before, pushing the vaccination, and it is vaccine ready. Look, we know there were some issues, and they pulled from the market temporarily the J&J vaccination. There's nothing wrong with the Moderna or the Pfizer. We had a drive-through vaccination day at our church, working with our state convention, and it was a great opportunity for people who took advantage of it. I and my wife have taken both shots of the Pfizer, and I still got 5 fingers on each one of my hands and everything. I still got 2 eyes and everything else and all this other type of stuff. It worked. I'm telling you, you're better off to get the shot than let COVID knock you out. And it's not over. It's not over. Look, right at my desk, I keep it. Somebody comes up, even though I've had my shot, I still wear my mask. Amen. And then even though we have our church service and stuff, we still got our mask and using physical distancing. All right. Sister Carper put in our chat to go to our webpage, Facebook, Twitter feed, YouTube. Connect with us and learn more information about it. Don't forget to complete our survey. All right. Our webinar survey, as my late godfather said, the biggest room there is the room for improvement. Do that. All right. All right. I do want to recognize all our team members. Some of them are on with us tonight. My wife, Lottie Miner, Pastor Bernard Montgomery, Sister Bettina Campbell, Pastor Dexter Moraney, Sister Ellen McKnight, Sister Dr. Felisa Washington, Minister Geraldine Moore, Dr. Desi Levy, Sister Linda Copper, who's on with us tonight, Sister Loretta Miller, Dr. Lavora Williams, and Michelle Johnson. Once again, we acknowledge our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless and God keep you is our prayer. All right. We're going to end the social media part. For those on Zoom, we'll hang out for a few minutes. Any other questions that you have. So thank you to our